I'm Sharon Webb. I am the Clinical Mental Health Counseling Program Coordinator at Gardner-Webb University and also an Associate Professor. Currently serving as your counselor, as your President-elect for North Carolina Counseling Association for a few more months that I'm trying to stretch out as long as possible to glean from my predecessors before I have to kick it in without as much guidance. Although John thinks I'm going to let him get away as past president quickly, that's probably not going to happen. But those roles will change in July. So thank you again. This is a topic that's near and dear to me, and a topic that I've had some additional training in, and I'm really excited to be able to share this with y'all.
And I'm Dr. John Nance. Thank you all for attending. This is we are, like Sharon says, we are probably going to be gathering our thoughts every once in a while. I'll stare at this slide for a moment just to gather my thoughts. And so I am in NCCA. I'm the immediate past president, and I'm the chair-elect for the Southern Region with ACA. And National Division, the Association of Adult Development and Aging. I'm president for that group right now. And so I do a lot of volunteer work. And then also I've been in practice for about 19 years and supervising for a bunch. I honestly don't know of that 19 years. It's probably around 14 years I've been supervising in group settings, hospital settings, individual, in many different, both clinical supervision for master's programs, and also then for licensure. And we're so glad you're here.
Oh, no, honey, no, we're not still in our house. Thank you.
So our interest in this topic, these are our objectives that we put forward and what we hope that by the end of our session together that all of us would have had time to learn from each other. We do want this to be an interactive presentation. So we're here to learn from you as much as we're excited about sharing with what we know and have learned with each one of you as well. So reflecting on current practices, again, we want to hear from you throughout the presentation as well. And we'll have opportunity for that. Identifying how experiential interventions and self-regulation strategies, how we can all use those in counselor supervision and the importance for doing that. And then exploring different innovative and creative practices. And we'll have some time to apply at least one, if not two, self-regulation strategies. And then have an overview / reminder of the importance of our ethical code regarding the competencies of supervision.
Oh, Sharon, that picture comes from 2020 when we actually, I think that's the last time we saw each other in person.
The last face-to-face conference, yes.
It really was. Yes, as well as our leadership. It's been pretty amazing. Yeah, as we know that we've got a vast and different differing audience with us today, and I would be really curious if you would put in chat what some of your roles are as supervisors or in the counseling profession or students. So if you don't mind just putting in there in the chat, what is your role? Are you a licensed supervisor, a licensed professional counselor, or educator, all of the above? Be really interested. So as we get to know you, and I'm going to be watching here a little bit, we know that we've got a diverse audience. We also know that each one of us, I can't imagine anybody in this room that would not have been supervised or is not being supervised. And so I also want to remind those who may feel a little bit green that we're all there with you. I just started some EMDR training, advanced training, and I'm in supervision for that right now, and I feel like a novice. And so I find myself asking very basic questions because I'm stuck on something, and also find my own shaming find my own resistances. And so I don't know that supervision ever really gets easier if we really go into it. But I just really welcome all of you as I'm watching. We do have social work individuals. We've got licensed mental health clinicians, and students and directors of agencies. I tell you, we've got quite a diverse audience, and we're glad you're here. And I will then turn this over then to Sharon.
Yeah, I just realized I had hit my camera off. Sorry about that. Yeah, this is a quote that one of my favorites that I just wanted to share as a reminder from Maya Angelou, that it's really important. And there's also collective value as we care for ourselves, and also recognize the importance of caring for ourselves as we care for other people as well. And a great forum for us to do this is in the supervision process with our counselor trainees or with our associate licensed supervisees. And we can model that, as well as I believe even have active practicing with them in sessions is really important.
I really do miss practicing in face-to-face, because I would be just kind of going around the room here and saying, okay, what type of modality of supervision do you practice as supervisors? What are your modalities? And so I do ask you, if you would put that in the chat, and we'll watch that. Then also, as supervisees, what are the modalities that we experience? And are our practices effective? Yes, probably they are. But could we be more effective? And that's just a obvious answer of, yeah, we could always learn and grow and be more effective, I'm sure. And I forget, I get so comfortable in my practice. I am so laid back with my supervisees that sometimes I remember or forget that there are other ways of doing things, and have to remind myself. And I have, for a long time, we'll talk about this in a little bit, I have practiced sand tray supervision, and I forget about it sometimes. I forget that cabinet on the wall is useful in supervision, as well as in interventions with counseling with adults. And so this is a reminder of myself also, is I could be much more effective. And so one thing I want to do is we just also want to revisit some of the ethics, just to remind us that, yes, there's an entire section in the American Counseling Association Code of Ethics, section F, I believe. Yes, F is all about supervision. And so I put this in there just to kind of revisit just a few pieces of this. Counselor supervision competence is about preparation. It's about making certain that we are learning, we are competent, we are considering interventions that are focused not only on clients, but also on our supervisees. We have multicultural focus, diversity, and inclusion concepts that we interweave throughout our work. I believe that is an absolute necessity. And then if we're doing online supervision, which we've all been forced to do, is how do we do it? And how do we use some of those technology pieces? So it's just kind of a review as to look back into the Code of Ethics in the full section of F to make sure that we are working in an ethical manner.
And again, I have another favorite quote here for you. So these are some of the things that kind of speak to me. And as John shared before, the reminders of himself with play therapy that he's accustomed to, but sometimes forgets. Poetry and quotes, inspirational quotes, those kinds of things really speak to me and help me to recall things that are really important that I may overlook in supervision with my counselor trainees, as well as my associate licensed supervisees. And so this quote from Perry tells us, if people are anxious, uncomfortable, or fearful, they do not learn. The only caveat that I will throw out here that we could maybe disregard in certain contexts of this quote is the uncomfortableness, because I do encourage students especially in the very beginning, from when they take multicultural counseling class, that my hope for you throughout this semester, more than anything else, is that you get uncomfortable. We want you to be uncomfortable to grow and to learn and to show openness. So this is not the kind of uncomfortableness that Perry is speaking to here. This is more of a stress response, very uncomfortable feeling and sensation in our bodies. And so recognizing that anxiety and stress, it really, those are threat responses. It's a threat response. And counselors need to know how to interrupt their own threat responses. And so supervision is a great setting for us to help our supervisees with that, to know how to effectively self-regulate and apply those strategies. Because distress it's not just cognitive, but it is physiological. So our ability to relax, self-regulate, to lessen that distress, it's very well documented. And there is a difference. Some people may think that relaxation is self-regulation. Self-regulation is relaxation, but relaxation in itself is not self-regulation. When we self-regulate, that's the ability that we allow ourselves, or we train ourselves to have just enough relaxation to inhibit that stress response. And a great example of even how this is, how our military snipers are trained. I don't know if we have any avid readers or if you like to read military books or anything, but there are actually a couple of books written by Lieutenant Colonel David Grossman. One of them is on combat and the other one is on killing. And I know it sounds horrid with the titles, but he actually discusses in one of those books, I think it's the on combat one, maybe the on killing one, how they train snipers to really self-regulate and to breathe and to focus, and how they go through that process too. And so very effective in military training as well. And so I don't know, we'll have supervisees, I'm sure, that work with military and other intense fields, that those can be recommendations for them to pass on and read to. So we do need creativity in whatever areas of our strengths. It is important that we do practice within our realms, as our code of ethics tells us to facilitate and practice within our scope that we've been trained in. But we all have different modes of learning. So and even truly experiencing. So if we can be open and willing as supervisors to practice, and as educators to practice and apply those creative approaches, then we can better facilitate that same with our supervisees, and then they carry that forward on with their clients as well. So question we have here for you, and we would love to see this in the chat as well. Again, we want this to be interactive, and so we would love to hear and to see some of your comments and ideas of how you approach supervision, either with counselor trainees, and maybe you as a supervisee also share what are some creative ways or different modes, interesting ways that you enjoy how your supervision occurs with your supervisor. And feel free, if you'd rather, instead of the chat, unmute yourself and share. We'd love to hear from you. Oh, I'm seeing hypnosis, John.
I know, I saw that.
Cool.
I know.
Free
Yeah.
writing, yes.
Yep.
Trauma informed, really important too.
Yep. And I'm also very curious. I would love to have conversations after this of, okay, as we look at discrimination models and developmental, trauma informed and feminist models of the creativity within all of those, because there are so many ways to be creative, and I wish we had a pre-con with 3 hours to where we could sit and converse and learn from each other in those.
Yeah, even occasionally I will pull out, so biblio supervision, even like a children's book, like The Giving Tree, and go through, like, you have people kind of apply that, supervisees, what's going on in your current life that you're giving, like the Giving Tree, and how's that process. It's really interesting to see how supervisees share their own stories and go through that, and come to different conclusions with that process. To cinematic supervision, I myself have not approached supervision cinematically. John, have you? I've heard and I'm interested in that, but I haven't tried that one yet.
I have not. And I take that back. I have played. Not cinema necessarily, but definitely video for me. And I will absolutely pull in different videos into a supervision process, without question.
Art-based, I do a lot of art-based. And so having, a guided kind of activity, for example, where they are drawing out, and I bring in the markers or colored pencils and different things and papers in for them to do art-based. Another one, you'll see the mask that I just recently did, again with supervisees, is where I have different mask templates, and I will have those pre-cut out and have them think through their like self as counselor, and processing that. So have like how they see themselves, their strengths as a counselor, maybe on the outside, and maybe those areas they're still challenging for them or they're struggling about on the inside. Or it could be like fears on the inside and accomplishments on the outside, or what we want our client to see on the outside and what we don't want clients to see on the inside. All kinds, even with supervisor, what do we hope that our supervisor sees in us on the outside, and what do we want to keep to ourselves, and give them the privilege and the space to share or not share whatever they're comfortable with in the group, and processing that. But those perceptions of self, perceptions of others, cultural assumptions, all of those. And I've actually had several supervisees who have taken this and used it in different ways with their clients, and they're so excited to come in and share how that went with their clients. And then John's going to talk to you a little bit more about some sand tray supervision as we move forward. Movement, I've done movement a couple of times. I'm trying to read comments too to see what all you are doing, because
we've got some like Keith talks about, definitely documented. Absolutely, we don't have a lot of that mentioned in here, Keith, and I'm glad you said that. Is the documentation supervision is critical. That's we absolutely need to. And then just it's almost like parallel processing, how our supervisees are working with their clients, and then how we work with our supervisees. And I love the phrase, Angela, from soul care practices. And we're going to be talking about some of that here coming up.
And I would love to hear from Carrie, if you're uncomfortable with unmuting, to tell us about your movement that you do.
So in my supervision with supervisees, movement actually looks different for each supervisee. For some, it's squats. For others, it's jumping jacks. Because a lot of my supervisees work with youth and adolescents. And so especially for the youth and adolescent clients that have ADHD, they like to themselves also practice activities that they can give their client to be able to focus their energy or have a positive outlet for that energy. And so that's how we use that movement in supervision. It helps to relax them also.
Yeah, that's a great idea. You know, I haven't done a lot of movement in supervision. I've had supervisees stand up and, like, if I see they're like, oh, you know, or whatever, let's stand up and shake it out a little bit and move around and do something. The closest I've personally used movement for actually was at the start of COVID, and everyone has this. You're teaching virtually for me for the first time since we're a face-to-face program. And everyone's kind of like zoned out, or they have this look of horror. How are we going to get through this virtual class? And so I queued up, I don't know if any of you are familiar with Kirk Franklin, and one of his older songs called Stomp. And I stood up and started stomping out and really cutting up with them. And it was a lot of fun. They got into it too, as I encouraged them. And that seemed to break up a lot of the anxiety and stress and stuff. So I'm saying, yeah, I see some yeses to Kirk Franklin Stomp there. It's good. And I saw another one too. Jennifer Morris shared, we had to act out a secretly given outside the sessions, watch untraditional movies, and discuss possible diagnosis, somatic movement, and vagus arousal. Oh, good. Vagus arousal regulation demonstrations. Interview partners or friends on what they see our self-care practices are working in areas to develop. Oh, yeah. Wonderful, Jennifer. Yeah. That's,
I have used, it is some kind of a movement. I have a blessing of having my office right next to a city park, a linear park. And so I call it walk supervision, where depending on, and it's usually when Mac's stressed out, close burnout, whatever it is, where the focus is not in the room and anxieties are high. I will usually try to figure out, is this a time just to go out and just to demonstrate mindfulness? And we might do a color walk and notice everything green. Might do a sound walk. What do you hear? Close your eyes right here. What you're hearing, and just to find their groundedness, and to remind them that their clients are not here right now, and that they are here right now, and to take care of themselves, and then start to focus on the interventions with clients.
oh, I love it. Love it. So in thinking about all of these different creative ways that we help our supervisees, these are just some bullet points from some of the different trainings that I have taken. And so acknowledging whatever those concerns are, supervisees, especially coming in at practicum level, and even as new associate licensed professionals, there's a lot of anxiety, new feelings that are stirred up with that. So using that supervisory process to really acknowledge that concern, heard and acknowledged with that experience can help them with calmness, and it without giving false assurances or minimizing. It's okay, don't worry about it. But really being genuine with them with that. And then, of course, applying that empathy and calmness, ask open and I try to model this when I do check-ins with my supervisees by sharing a little bit of how my week has been and different things that may be happening too. So modeling that, asking them to share any of their thoughts or feelings that they're comfortable about opening up, and providing that safe space, non-judgmental space for them to do that. Maybe frightening experiences will come out with, a client in the room that they were not prepared for. Lots of things come up. And so really just being supportive as much as possible. John, one of the things that I thought of immediately when you said, I kind of laid back with supervision process and everything too. I have to remind myself too with the importance even of routines with that as life gets in the way, and all the different things that we have going on too, that the importance of how that can help our supervisees too with their, even as we model that with them establishing routines of all those responsibilities that they're trying to juggle. And then temporal distancing. So helping them to focus their attention, not really on a time scale, but not just the present moment, but imagine how you might look back on these events in a year and put that out, that historical context that, we've experienced these things, different kinds of things before. What have you experienced before and how did you get through them? And then just recognizing that there are things in different situations. Each client is going to bring in different things that we can't control. And so recognizing what we can control and what we can learn from is really important. And then those breathing exercises. And again, one of the things, this is just my personal thing I'll throw out there and disclose to is I think sometimes where we fall short in supervision is that we may tell our supervisees in our feedback, try doing breathing exercises or try this or try mindfulness or try, all these different things with your clients, but we're not showing them. So taking the time to show them in that supervision session can be really beneficial, and it can help their confidence to grow, to be able to do that as they practice it themselves.
Absolutely.
So again, this just a reminder again of all the different ways that anxiety can affect us, can affect our thoughts, our supervisees' thoughts, and where our mind goes. Can I do this? What, and that imposter syndrome that even we as supervisors have that we struggle with. And so anxiety can shift our change with our thinking, recognizing that, it affects, again, stress is physiological, that it takes a physiological toll on our bodies. And so recognizing that it can affect our spirituality sense of, whatever we believe or, our hope or whatever at times too. And so our self, our holistic self is comprised of different areas that anxiety can affect us in. And every one of us are vulnerable at times, and we have different threats. And it's important for us to just, I believe, model that and be open that with our students. I will share, there are a couple of things. So this is just a different spin off of, you probably are all familiar with the wellness wheel. And this is a little different spin that we created for you to consider, especially as you look at the question marks up there. What's missing? What, there are all kinds of other things, or what is a practice that we can do? So there are some things that are very free resources. I like the word free as an educator. And so the wellness wheel, there's a free online assessment that you can download. I'm happy to share. I have PDFs of these, but you can Google it and also find it too. And the one thing that I do differently with supervisees, instead of what you may find in some of the free downloads, is I focus on, like, when they do that assessment, then I look at those fulfilled areas first instead of starting the other way, and helping them, really focus and hone in on their strengths and what they might be able to use. And then they can, again, help their clients with doing the same thing. And after that, then they can use, you can then discuss goals, resources, that plan of action. And then another really good resource for holistic wellness is put out by the Center for Victims of Torture, CVT.org. And it's the Professional Quality of Life. So it's Pro QOL 5, version 5 is the most recent. And that is free online. You can also download the PDF, discuss that quality of life and reflect on it, and look at different areas of potential for compassion, satisfaction, or secondary traumatic stress, burnout, all of those things that that may carry over into our supervision experience, supervisee experience, and our client experiences. So again, just to kind of revisit some of the benefits of any kind of experiential interventions, you can see here for helping with the stress and boredom, connecting us in positive ways with other people, stimulating that creative thinking and exploration, regulating, practicing skills, and then learning, how we can best foster ourselves through play in different ways.
And that's where I step into play therapy, right? With Sandtray and Sandtray supervision. And I think the first time I experienced Sandtray was probably as a doc student at UNCC, where I think it was Dr. Jack Colbreth, who was my supervisor at that time. He just pulled out a portable little Tupperware Sandtray thing. And we did some Sandtray supervision and reflective processing there. And I know that this picture does not portray Sandtray therapy, right? Or Sandtray supervision. I kind of laugh when I start Sandtray with some people. They're like, what am I supposed to do? Draw in this? Or, how do I do this? And sometimes it's the same feeling in supervision. How do we use Sandtray in supervision? And I've had this, I try to figure out even how to be creative with the creative. One of the things I used to do in the hospital setting, because obviously Sandtray is metaphor, and we use it as metaphor. And I would have a tape presentation where the session was taped with permission of the client, and the presenter would play their session, and then I'd have a person construct the Sandtray of what they're listening to, with the relationship in mind. And they would construct it in that manner. And then I would process what they heard with the person who constructed the Sandtray. It's not even the person who's presenting, it's the people who are listening. It sort of follows a little bit in the Diane Borders model of peer group supervision, where you've got one person listening as the therapist, you've got a person listening as a client, you've got a person listening as metaphor, and the people who are listening in those roles share with each other while the presenter listens to the interaction. And love that model and I use that quite a lot. And I do it similarly in Sandtray. One time I had 2 Sandtrays. I had 2 listeners, and they were back to back, and I had probably over 100 objects in identical objects for both trays. They were back to back, and they chose the same objects and constructed the tray. It was a spiritual moment in unbelievable ways as they heard it, and there were no cues to say, they drove a car and put a car in the sand tray. That was not what it was. They were objects that really had no relationship to the direct story. It was pretty remarkable. And so I do believe in the use of metaphor, the use of sand tray when we can, and it can be a really cool experience. Then I'm going to tie it into the idea of virtual supervision, and what does that look like? And the reason I say that is here I'm going to go take you to then a website that Sharon actually introduced me to, and I was like, oh, this is amazing. I don't know if you've ever seen this in Sandtray. It's onlinesandtray.com. And so here's your tray, and you've got pages of objects. We can, let's see if we can do it. There we go. Now I can move that object anywhere in there. So we've got now a dragon. I don't know. Let's go way up, fire. We're going to do fireballs here.
You can change the sizes of any of those objects too, to show the different power.
I love it. So it's actually quite fun. I'll have to quit focusing there, or I will stop talking. Because any way that we can be creative in this, I think is really important. And I'm finding in the virtual world, there are so many resources for us. And this is just one of those. And as we talk virtual and as we talk electronics and social media platforms, I do believe they've got place in conversation in supervision. And I do think we have to be creative in this. I'm going to say it, an old lizard like myself, who is not very connected except for in those things that are about 15 years old, right? I'm behind the ball a lot, and often I learn a lot from my supervisees and students. And so when it comes to the virtual world, and then when it's also about our ethics in our technology, this could be a whole nother presentation or two about how do we use the technology with our supervisees. I have my iPad always at my side, and it's usually on with either my calendar, or I'll say, pull out your technology and then we either discover together. I will have my technology very close in supervision so that we can Google together, and explore and try to find resources in learning. I just think that's where we are. Technology is at our fingertips. We don't have to dial the rotary anymore, the rotary phone, for those that don't know what that is. And I've got the symbols here, and I didn't even have TikTok on there. And Sharon's like, what about TikTok? And technology, I think, is really important. I also have a question, and it comes in kind of with our ethics. We know that we do not locate and observe our clients in their social platforms. That's unethical for us to do that. With supervisees, it's kind of a different story, but I'm not their parents. I'm not going to necessarily monitor their use of any of the platforms. I tell clients, obviously, we're not going to connect with technology in any of the platforms. Supervisees, that's a little bit different story. We're colleagues and different relationships. Will we connect? And I also say, if we connect, I'm going to have a window that I sometimes may not want to see, but I will. And if I'm supervising a school counselor or somebody who works with children, and they're posting pictures of the drawing that they got that day, I comment in supervision, I react to that very strongly. That's privileged client information. I always believe that. I always believe that. And so I try not to monitor, but I also know that sometimes the platforms show up in ways that I just wish they didn't always. How do we monitor our supervisees? Obviously, we're listening to their tapes, we're observing their sessions, we're hearing their description of their sessions. But I also believe that we are in charge of, and Sharon has shared this a couple times in different ways, we are to monitor their emotional experiencing, their emotional health and wellness in their professional world. And sometimes it spills out, their personal world spills out. And it's hard to separate the two. And so I do think we're supposed to be monitoring emotional well-being, emotional health, and related to their professional dispositions. And I say that, and I move then into a bibliotherapy in some ways, or supervision. One of my joys is supervising different groups with agencies. And one of the groups I'm working with right now is Children's Homes of Cleveland County in North Carolina. And we've started going through trauma stewardship. It's by Laura Vandernoot Lipsky. And I thought, I'm not going to really engage in this book because I have a difficult time sometimes engaging. And the first 2 chapters were like, oh my gosh. I had to put it down that first 2 chapters because it caused me to reflect on my own impact. I work primarily in my practice with adult survivors of early childhood catastrophic torture and trauma. And so a lot of dissociative identity disorder symptoms. And that vicarious traumatization is a serious thing. And this is one of those resources we're working through in their agency. How can you not work right on the teetering of burnout? And so we're working through this book. And I find that just even at that, and in working with trauma with them is a creative way to explore it, a safe way that they can read about it, reflect on it, and then we can converse about it in our sessions then. And then I'll shift this back to Sharon then.
All right, I promised time. We have just a couple of minutes to try to practice. I'm going to practice what I preached earlier about the importance of not just telling supervisees to do this with your clients, but having intentional time with them too. So just really quickly, a reminder about breathing. Breathing retraining is a skill that helps us relax. And so when people do become anxious, our breathing is usually the first thing that changes, that we notice that changes. And so even learning how to control that can help in the short term for immediate distress. So when we start to feel anxious or uncomfortable, and that breathing starts becoming faster or more shallow or less smooth or whatever the change is, by noting that, and then making that intentional change, the rate, the depth, then that is going to signal our brains and our bodies that we're going to be okay. And it helps us to relay messages for our whole system to have more calmness. And that's basically called the regulation. Any kind of regulation, meditation, mindfulness should always begin with getting those good, deep, what we call belly breaths in to help with that regulation first. So stretches can also help, but this slide is just a reminder of that, with making sure that we're breathing the correct way. And sometimes people think they're getting in the good breaths, and it's not really actual good, deep belly breaths, because if you watch people and they take those deep breaths and like I have them maybe put their hand on the chest and hand on the belly to see where their movement is, because most people will go, and that's not the good belly breathing that we need to get down into our diaphragm. The only thing really that should move is our stomach expanding. So we can go to the next slide, John, and I will follow through on my promise to do a little exercise with you, as much as you're comfortable doing with me in our last few minutes here. And so I'm going to ask that you, now we can't see you if your camera's off, that's fine. That gives you a safe place to do this exercise with us. If you do have your camera on, feel free to turn it off. Or if you want to just look down instead of looking out at me and John, then that may be more relaxing than looking at us.
I'm attending a.
Okay, all right. So, so I'm going to ask you first to take a couple of really good deep belly breaths. Inhale and exhale. So with your eyes closed or looking down, there may be places that you enjoy going outside of your home or outside of school that you haven't always been able to access during this pandemic. And during stressful times, we can still experience those through visualization. So get as comfortable in your chair. Continue those deep, relaxing breaths. Now, with your eyes closed or looking down, picture your favorite place. Maybe it's the beach, a mountain cabin, your grandma's kitchen, anywhere that brings you peace and comfort. Imagine you're at that favorite place right now. Think about what you might see as you're looking around in your place. Be as detailed as you can and come up with 2 to 3 things that you're seeing. Imagine what you're hearing. Are there noises from being outside? Maybe you hear the wind, people talking, a dog barking. And now focus on your sense of smell. What aromas are you smelling? Is it freshly cut grass? Warm cookies, maybe? Salt water? And considering taste. What taste is on your lips? Salty air? Something delicious you're eating or drinking? And now last, picture what you would be touching and feeling at that place. Do you feel a breeze? Warm temperature? Just sit with this for a moment. The more detail that you build in, the better. And just enjoy that calmness that this place brings for you. And then when you're ready, you can open your eyes and come back into the room. And I would take it with more time and with supervisees, I usually take it a little bit slower to really have time to camp out a little bit in their favorite place. But we do want to end with giving you opportunity again to share with anything that someone would be willing or brave enough to let us know. We've shared kind of along the way things that we would like to try that are new or work on, but anyone else that would like to try that or share that with us, we would love to hear from you.